Ladies and gentlemen, there is something happening inside your body right now that you cannot hear, you cannot feel, and you cannot see. It doesn't knock on the door, it doesn't send a warning text, it doesn't create loud symptoms in the beginning. It works in silence, and by the time many people finally notice it, the damage has already been done. Heart disease does not usually begin with a dramatic moment. It begins quietly, slowly, over years. While you are busy building your career, chasing success, handling stress, skipping sleep, grabbing fast food, and telling yourself you'll focus on your health later. Later is the most dangerous word when it comes to your heart. Your heart beats about 100,000 times a day. Every beat is a gift. Every beat is life being pumped through 60,000 miles of blood vessels inside your body. You don't think about it, you don't thank it, you assume it will always be there. But your heart responds to everything you do, every bite of processed food, every hour of lost sleep, every spike of anger, every cigarette, every ignored checkup. Every moment of chronic stress. The scariest part about heart disease is that it often starts without pain. Plaque can build inside your arteries for years. Inflammation can rise quietly. Blood pressure can climb gradually. Cholesterol can increase silently. You may feel fine. You may look healthy on the outside, but inside your arteries could be narrowing millimeter by millimeter. By the time chest pain appears, it may not be the beginning. It may be the warning that you're already far down the road. This is why awareness is power. Your body whispers before it screams. Fatigue that you brush off. Shortness of breath when climbing stairs. Brain fog. Cold hands and feet, elevated blood pressure readings you ignore because you feel okay. These are not inconveniences, they are signals. And the sooner you listen, the more control you regain. Heart disease is not only about genetics. Yes, family history matters, but lifestyle speaks louder than you think. What you eat shapes your blood vessels. Movement strengthens your circulation. Deep sleep repairs inflammation. Stress management protects your arteries. Hydration supports blood flow. These are not small details. They are daily decisions that determine whether your arteries stay flexible or become stiff and clogged. Chronic stress is one of the most underestimated threats to your heart. When you live in constant fight or flight mode, your body releases stress hormones like cortisol and adrenaline. Your blood pressure rises, your heart rate increases, inflammation grows. Over time, this constant pressure damages the inner lining of your arteries, and damage creates opportunity. Opportunity for plaque to build. You may not feel stress damaging your arteries, but it is. Now think about diet. Highly processed foods, loaded with refined sugars, unhealthy fats, and excessive sodium create a perfect storm. They increase blood sugar spikes, promote insulin resistance, raise triglycerides, and contribute to inflammation. This combination slowly injures the delicate inner lining of your blood vessels. And when that lining becomes irritated, cholesterol particles are more likely to stick. The process is silent, but it is powerful. On the other hand, when you nourish your body with whole foods, colorful vegetables, fruits rich in antioxidants, healthy fats, clean proteins, fiber, you are not just eating, you are protecting. You are lowering inflammation, you are improving endothelial function, you are supporting nitric oxide production, which helps your blood vessels relax and widen properly. Movement is medicine. Your heart is a muscle, and like every muscle, it becomes stronger when you use it. Regular physical activity improves circulation, lowers blood pressure, balances cholesterol, enhances insulin sensitivity, and reduces stress hormones. Even 30 minutes of brisk walking can shift your cardiovascular health in a powerful direction. Sedentary living is the new silent risk factor. Long hours sitting reduce blood flow efficiency, they impair metabolic function. They contribute to weight gain and vascular stiffness. You don't need extreme workouts, you need consistency. Daily motion tells your heart, stay strong, stay flexible. Stay resilient. Sleep is another silent protector. During deep sleep, your body repairs tissues, balances hormones, and reduces inflammation. Chronic sleep deprivation raises blood pressure, disrupts blood sugar control, and increases stress hormones. When you sacrifice sleep for productivity, you may be silently sacrificing heart health. And then there's the danger of ignoring numbers. High blood pressure is often called the silent killer because you rarely feel it. High cholesterol does not cause pain. Elevated blood sugar can go unnoticed for years. This is why regular checkups are not optional. They are preventive power. When you know your numbers, you gain leverage. Prevention is not fear-based. It is empowerment-based. Imagine discovering a small crack in a wall. If you fix it early, the repair is simple. If you ignore it for years, the structure weakens. Your arteries are no different. Small changes today prevent catastrophic events tomorrow. A heart attack does not usually happen out of nowhere. It is often the final result of years of silent buildup, inflammation, and vulnerability. But here's the empowering truth. The same way disease develops over time, healing and protection also develop over time. The body has an incredible ability to repair when you give it the right environment. Lowering inflammation, improving diet quality, exercising consistently, managing stress, prioritizing sleep, staying hydrated, maintaining a healthy weight, avoiding tobacco. These are not abstract suggestions. They are daily investments in the flexibility and strength of your arteries. It's easy to believe that heart disease happens to other people, older people, people with obvious symptoms. But the reality is that cardiovascular issues are affecting younger individuals more than ever due to modern lifestyle patterns. Long work hours, digital overload, fast food, convenience, emotional stress, lack of movement, these are becoming normalized. But normal does not mean safe. The time to protect your heart is before you feel something is wrong. Start small. Replace one processed meal with whole food. Add a 20-minute walk. Go to bed 30 minutes earlier. Practice deep breathing to calm your nervous system. Schedule a health screening. Drink more water. Choose olive oil over processed fats. Increase fiber intake. Reduce added sugars. Build habits that are sustainable. Small changes repeated daily create massive protection over years. Your heart is not asking for perfection, it is asking for consistency. It is asking you to stop postponing what matters most. You may not feel plaque forming, you may not feel blood pressure rising, you may not feel inflammation building, but you will feel the consequences if they are ignored long enough. The beautiful part is this: you also won't feel your arteries healing immediately. You won't feel inflammation decreasing overnight. You won't feel cholesterol improving day by day. But it is happening when you commit to change, quietly. Just like disease builds quietly, so does resilience. Every healthy choice is a vote for a stronger heart. Every step you take strengthens circulation. Every deep breath calms your vascular system. Every nourishing meal protects your inner lining. Every night of quality sleep restores balance. Don't wait for pain to convince you. Don't wait for a scare to wake you up. Your heart has been loyal to you since your first breath. It deserves your attention before it's too late. Heart disease does not usually arrive with noise, drama, or immediate pain. It begins in silence, often years before a person ever feels a single symptom. This is what makes it so dangerous. While you are living your life, working, eating, stressing, sleeping too little, and assuming everything is fine, subtle changes may already be happening inside your arteries. The process is gradual, it is microscopic, and because you cannot feel it, you believe nothing is wrong. Inside your blood vessels is a delicate lining called the endothelium. This thin layer plays a powerful role in controlling blood flow, regulating inflammation, and maintaining vascular flexibility. When this lining is healthy, blood moves smoothly and efficiently. But when it becomes irritated from high blood pressure, elevated blood sugar, smoking, chronic stress, or unhealthy fats, tiny injuries begin to form. These injuries are not painful. You don't wake up feeling them. You don't notice them during your daily routine. Yet they create the perfect environment for plaque to begin accumulating. Plaque is a mixture of cholesterol particles, inflammatory cells, calcium, and other substances that gradually stick to the damaged areas of artery walls. This buildup narrows the passageway where blood flows. It doesn't block the artery overnight. It builds millimeter by millimeter, year after year. Because the narrowing happens slowly, the body often adapts. You continue walking, working, and exercising without realizing that your arteries may already be compromised. High blood pressure is another silent contributor. Many people live with elevated blood pressure for years without any symptoms at all. There may be no headaches, no dizziness, no warning signals. Yet with every heartbeat, increased pressure pushes against artery walls, causing microscopic stress and injury. Over time, this constant strain weakens the vessels, reduces elasticity, and accelerates plaque formation. The damage is occurring quietly, beneath awareness. Cholesterol imbalance follows a similar pattern. Elevated LDL cholesterol does not create an immediate sensation. Blood tests may reveal the numbers, but without testing, you would never know. When LDL particles circulate in excess, especially in the presence of inflammation, they can penetrate damaged artery walls and contribute to plaque buildup. Years can pass before the narrowing becomes severe enough to restrict blood flow significantly. Blood sugar plays a critical role as well. Insulin resistance and chronically elevated glucose levels damage blood vessels from within. Excess sugar molecules attach to proteins in a process called glycation, which stiffens and weakens vascular tissue. This accelerates aging of the arteries and increases the risk of blockages. Yet many individuals with prediabetes or early diabetes feel completely normal. There's no sharp pain signaling the progression. The internal damage continues silently. One of the most underestimated factors is chronic stress. When stress becomes constant, the body remains in a heightened state of alert. Stress hormones such as cortisol and adrenaline stay elevated, increasing heart rate and blood pressure. Over time, this persistent activation creates inflammation and endothelial dysfunction. The person may simply feel busy or tired, unaware that their cardiovascular system is under continuous strain. Emotional stress, financial pressure, unresolved trauma, and lack of relaxation all contribute to this invisible burden. Because the progression is gradual, the body often compensates. If one artery narrows slightly, blood may reroute through nearby vessels. This compensation can mask the severity of the problem. You may climb stairs and feel only mild shortness of breath, dismissing it as being out of shape. You may experience occasional fatigue and blame it on work. The subtlety of these signs allows the disease to advance undetected. The first dramatic symptom, such as chest pain or a heart attack, is often N. At the beginning of the disease, it is the culmination of years of silent development. A heart attack frequently occurs when a plaque ruptures suddenly, forming a clot that blocks blood flow. That sudden event may feel abrupt, but the underlying process has been unfolding quietly for decades. This is why regular screening and awareness are so important. Blood pressure checks, cholesterol panels, blood sugar testing, and inflammatory markers provide insight into what cannot be felt. Without these measurements, silent progression continues unchecked. The absence of pain does not equal the absence of disease. The body does not always send dramatic warnings before serious events. Modern lifestyles amplify this silent risk. Sedentary habits reduce circulation efficiency. Processed foods increase inflammation. Sleep deprivation disrupts hormonal balance. These factors compound gradually. No single day seems catastrophic, but over years the cumulative effect becomes powerful. The silence of heart disease is deceptive. Humans tend to respond to discomfort, to obvious problems. When something hurts, we act. When something feels normal, we assume safety. This psychological tendency allows cardiovascular damage to progress beneath awareness. The quiet nature of early heart disease creates a false sense of security. Understanding this silent progression shifts perspective. Instead of waiting for symptoms, proactive action becomes essential. The goal is not to live in fear, but to live informed. Recognizing that the absence of pain does not guarantee health empowers earlier intervention. It encourages consistent monitoring, balanced living, and conscious choices before irreversible damage occurs. The most dangerous aspect is not the sudden event itself, it is the years of unnoticed change leading up to it. When you understand that heart disease builds quietly, you begin to R. Expect the invisible processes inside your body. Awareness replaces assumption. Prevention replaces reaction. And the silence that once hid the problem becomes the reason you choose to act early rather than too late. Your daily lifestyle choices are not small and significant decisions. They are instructions you give to your heart every single day. With each meal, each hour of sleep, each step you take or don't take, you're either strengthening your cardiovascular system or slowly weakening it. The heart responds to patterns, not isolated moments. It adapts to what you repeatedly do. Nutrition is one of the most powerful influences on long-term heart health. Highly processed foods, refined sugars, artificial additives, and unhealthy trans fats create internal stress within the body. They trigger inflammation, disrupt blood sugar balance, and alter cholesterol levels. When blood sugar spikes frequently, insulin levels rise repeatedly, leading over time to insulin resistance. This metabolic imbalance damages the inner lining of blood vessels and accelerates plaque formation. Excess sodium increases fluid retention and raises blood pressure, forcing the heart to work harder with every beat. Saturated and trans fats, when consumed in excess and combined with inflammation, contribute to lipid imbalances that promote arterial narrowing. On the other hand, whole, unprocessed foods work in the opposite direction. Vegetables rich in antioxidants help reduce oxidative stress. Fruits provide fiber and phytonutrients that support vascular function. Healthy fats such as those from olive oil, nuts, and seeds support balanced cholesterol levels. Lean proteins assist in maintaining muscle mass and metabolic stability. Fiber plays a crucial role in removing excess cholesterol from the body and improving gut health, which is increasingly linked to cardiovascular wellness. These foods are not just calories. They are information that guides your biology toward protection or toward risk. Movement is another daily decision that shapes your heart's future. The heart is a muscle, and muscles grow stronger with use. Regular physical activity improves circulation, increases oxygen delivery, lowers resting heart rate, and enhances blood vessel flexibility. Exercise stimulates nitric oxide production, which allows arteries to relax and widen properly. This reduces blood pressure and improves overall vascular efficiency. Consistent movement also improves insulin sensitivity, helping the body manage blood sugar more effectively. A sedentary lifestyle sends the opposite message. Long hours of sitting reduce circulation and slow metabolism. Over time, this contributes to weight gain, higher triglyceride levels, and increased inflammation. Even individuals who appear outwardly healthy can experience metabolic changes if they remain inactive for prolonged periods. The body was designed for motion. When movement disappears from daily life, the cardiovascular system gradually loses resilience. Sleep is often underestimated, yet it plays a critical role in heart health. During deep sleep, the body repairs tissues, regulates hormones, and reduces inflammation. Blood pressure naturally dips at night, giving the heart and blood vessels time to recover. Chronic sleep deprivation disrupts this cycle. Elevated cortisol levels persist, blood pressure remains higher, and insulin sensitivity decreases. Lack of sleep also increases cravings for sugary and processed foods, creating a cycle that further stresses the cardiovascular system. Over months and years, inadequate sleep compounds other risk factors. Stress management is equally essential. Occasional stress is normal, but chronic psychological strain keeps the body in a constant state of alert. Stress hormones increase heart rate and constrict blood vessels. When this state becomes prolonged, inflammation rises and blood pressure stays elevated. Emotional stress can also influence behavior, leading to overeating, smoking, reduced physical activity, or poor sleep. Managing stress through breathing techniques, mindfulness, prayer, journaling, or time in nature reduces sympathetic nervous system activation and supports vascular relaxation. A calm mind protects the heart in ways that are both immediate and long-term. Hydration is another subtle but meaningful factor. Blood is primarily composed of water. When hydration is inadequate, blood can become more viscous, making it slightly more difficult for the heart to pump efficiently. Proper hydration supports circulation, kidney function, and blood pressure regulation. Though simple, consistent water intake contributes to overall cardiovascular stability. Avoiding harmful substances is equally impactful. Smoking damages the endothelium directly, promotes inflammation, increases clot formation, and reduces oxygen delivery. Even occasional tobacco use compounds risk over time. Excessive alcohol consumption can elevate blood pressure and contribute to irregular heart rhythms. Eliminating or minimizing these exposures significantly reduces long-term cardiovascular strain. Regular medical monitoring is part of lifestyle responsibility. Knowing your blood pressure, cholesterol levels, blood sugar, and weight allows early intervention. Many risk factors develop silently, and without measurement, they remain hidden. Routine checkups transform invisible risk into actionable information. Prevention thrives on awareness. Weight management is not about appearance. It is about metabolic efficiency. Excess visceral fat, particularly around the abdomen, produces inflammatory chemicals that strain the cardiovascular system. Maintaining a healthy body composition reduces this inflammatory burden and improves hormonal balance. This is achieved not through extreme dieting, but through sustainable habits, balanced nutrition, consistent activity, and adequate rest. What makes lifestyle choices so powerful is their cumulative effect. One unhealthy meal does not cause heart disease. One missed workout does not damage arteries. One stressful day does not create permanent harm. It is repetition that matters. Patterns compound. Just as small financial investments grow over time through interest, small health decisions accumulate biological consequences. The empowering truth is that the body responds positively to improvement in any stage. Adopting healthier eating patterns can improve cholesterol within weeks. Regular exercise can lower blood pressure in months. Better sleep and quickly balance stress hormones. Even individuals with existing risk factors can slow, halt, or sometimes partially reverse progression through consistent change. Your heart does not demand perfection. It responds to direction. Every positive choice shifts the trajectory slightly toward resilience. Every negative habit nudges it toward vulnerability. Over decades, these slight shifts determine outcomes. Daily life may feel busy and overwhelming, but within those routines lie opportunities for protection. Choosing stairs over elevators, cooking one more meal at home, turning off screens earlier, taking short walking breaks, practicing gratitude or deep breathing, scheduling preventive checkups. These decisions seem simple, but they are biologically powerful. Long-term heart health is not determined by a single dramatic event. It is shaped quietly by the ordinary decisions made every day. Your habits become your health. And the consistency of those habits determines whether your heart grows stronger with time or slowly becomes burdened by preventa. Blee-strain prevention is not about fear or waiting for a crisis to appear. It is about empowerment, about taking control over what can be controlled before circumstances force you to react. Heart disease does not demand that you suffer symptoms before it can be addressed. The true power lies in acting early, in understanding that every decision you make today has a ripple effect on your future cardiovascular health. You cannot undo decades of neglect in a single day, but you can begin laying the foundation for resilience and strength right now. Prevention allows you to become the architect of your heart's destiny, rather than a passive observer of its decline. The first step in proactive prevention is awareness. Many people operate under the assumption that if they feel fine, they are fine. This is a dangerous misconception because heart disease often develops silently. Plaque can accumulate, arteries can stiffen, and blood pressure can rise without triggering pain. Awareness comes from knowledge and measurement. Regular checkups, blood pressure readings, cholesterol tests, and blood sugar monitoring provide insight into the state of your cardiovascular system long before a catastrophic event occurs. These numbers are not just statistics. They are early warning signals, guides to where intervention is necessary, and tools for empowerment. By paying attention to them, you give yourself leverage over a process that otherwise progresses unseen. Prevention also requires consistent action. Small, sustainable changes repeated daily are far more impactful than drastic, short-lived efforts. Every healthy choice you make is a vote for your heart's resilience. Replacing a processed meal with a nutrient-rich alternative, taking a daily walk, or adding a few minutes of stretching to your routine may seem minor in isolation, but over weeks and months they accumulate into profound ND protective effects. Similarly, reducing stress through mindful practices, breathing exercises, or journaling helps regulate hormones that affect blood pressure and inflammation. These incremental decisions compound, creating a protective buffer against disease progression that is invisible but powerful. The concept of empowerment through prevention extends to lifestyle consistency. Your body responds to patterns more than to occasional extremes. One healthy meal does not undo years of poor nutrition, but one poor habit also does not determine your fate if healthy patterns dominate. Exercise, for example, is not about intensity alone, but about consistency. Regular movement strengthens the heart muscle, improves circulation, and enhances the flexibility of blood vessels. This consistent physical engagement equips your cardiovascular system to withstand stressors that arise in daily life. Similarly, sleep is a protective force. Adequate restorative sleep allows the body to repair tissues, regulate hormones, and reduce inflammation. Chronic sleep deprivation erodes these protective mechanisms, making your heart more vulnerable, yet even small improvements in sleep quality restore measurable benefits. Empowerment is further reinforced by the understanding that prevention is multidimensional. Heart health is influenced by diet, activity, sleep, stress, hydration, and avoidance of harmful substances. Each dimension interacts with the others, creating a network of support or strain. You do not need perfection in every area, but you do need consistency across multiple fronts. Balanced nutrition reduces inflammation and supports vascular function. Regular movement improves circulation, and metabolic health stress management maintains hormonal balance. And sufficient sleep facilitates repair. When these factors align, they create a resilient cardiovascular system capable of adapting to challenges and resisting disease progression. Taking preventive action also cultivates mental empowerment. There is a psychological advantage in knowing that you are actively protecting yourself. Fear often paralyzes, but knowledge paired with action generates confidence. You begin to understand that heart disease is not an inevitable fate, but a process influenced by your choices. This mindset transforms health from a passive state into an area of personal mastery. When you recognize that your actions have measurable impact, you gain control, and control itself is a form of protection. Moreover, prevention allows for long-term planning rather than reactive crisis management. Waiting for symptoms to appear often means intervention occurs at a stage when damage is advanced, treatment options are more invasive, and recovery is uncertain. Proactive prevention, on the other hand, shifts the focus from reacting to avoiding. It emphasizes early intervention, reducing risk factors before they manifest as disease. Simple, consistent habits such as maintaining a balanced diet, exercising regularly, managing stress, avoiding tobacco, moderating alcohol intake, and keeping up with health screenings are not dramatic or difficult. Yet they offer profound protective effects over time. The empowering truth about prevention is that the body is responsive at any age. It is never too early or too late to start. Young adults who adopt healthy habits reduce lifetime risk of cardiovascular events. Middle-aged individuals can slow progression and sometimes reverse early damage. Older adults who maintain consistency can preserve function, quality of life, and independence. Prevention is not only about avoiding disease, it is about enhancing vitality, resilience, and longevity. Finally, prevention creates a ripple effect beyond your own health. By prioritizing heart health, you set an example for those around you. Family, friends, and colleagues are influenced by your choices. Healthy behaviors become contagious, fostering a culture of awareness and care. The empowerment you gain from prevention extends outward, impacting communities and creating a supportive environment where wellness is valued. Every decision you make today is a tool of prevention. Each choice strengthens your cardiovascular system and reduces your risk of future heart events. Prevention shifts the balance from fear and uncertainty to knowledge and control. By acting consistently, mindfully, and intentionally, you protect yourself from the silent forces of heart disease and cultivate resilience that supports every aspect of your life. Heart disease is a silent adversary, one that often advances unnoticed until the consequences are severe. Yet within that silence lies the greatest opportunity, the power to act before it is too late. Every choice you make, what you eat, how you move, how you manage stress, how you sleep, and how consistently you care for yourself, sends a message to your heart. These daily decisions accumulate over time, either building resilience or inviting risk. Awareness, prevention, and consistent action are your most effective tools. The body responds to care, attention, and intentional habits, and even small, steady improvements can create profound long-term protection. By understanding that heart disease begins silently, that lifestyle choices determine your risk, and that prevention is empowerment, you reclaim control over your health. You no longer need to wait for pain, for warning signs, or for a crisis to compel change. The opportunity is now. In the everyday decisions, the consistent efforts, and the mindful actions you take, each step toward nourishing your body, moving regularly, managing stress, sleeping well, and monitoring your health, is a step toward a stronger, more resilient heart. The message is clear. Don't wait until it's too late. Protect your heart, honor its work, and invest in your life with deliberate care and consistency. Your heart is silently loyal to you, and it deserves the same loyalty in return. Take action today, because the choices you make now will determine the quality and longevity of every tomorrow.